My name is David Kim. I'm an emergency physician working in all over the province in Vancouver and also on the island as well. With the Sprott Paramedical Program, I am the medical director and I oversee the curriculum development as well as the regulatory affairs of the program. I think to become a strong paramedic, you have to be obviously people-focused. You're dealing with people from all walks of life, from all ages, which is what makes it an exciting profession. At the same time, you also need to be really quick on your feet and hands, working with situations that are presented to you in all kinds of environments. It may be a car accident to someone's home, and you're in intimate situations where you're helping providers and provide care to patients from all walks of life. I think anyone can become a paramedic. There are obviously some logistical, physical constraints that's required, such as helping with patient transfers, being able to be dexterous with your hands with multiple medical procedures, such as inserting intravenous lines, as well as other procedures that are required. And of course, you also need to be able to drive a paramedic vehicle as well. I think the best aspects of being a paramedic is that you can help people in their times of need, when they really need something. When someone calls 911, it's usually when they need the help the most. Probably one of the worst days that they may have experienced in their lives, from care of a loved one to someone that's suffering from a heart attack to a stroke, or even a child that's sick. And that part of being able to help someone when they're needing the most help, I think is really a valuable and something that can really give back to providing help to your community and the people around you as well. The hardest aspects of being a paramedic is probably the job situation that you're dealt with, which can also be turned into a positive. Like I said before, you are sometimes in close quarters of a patient's home where you have to enter their living space, be respectful of that while being able to provide medical care. You're also in very extreme environments at times. You may be in the side of a highway or sometimes in a remote place or at a construction site providing care. There are all kinds of places where it may be challenging and the environment may not be favorable to you. It may be very hot, it could be cold, the weather may not cooperate, and it might be daytime or nighttime. And I think that dynamics of the environment, while challenging, could also be a positive aspect of the job. Well, the day in the life of a paramedic is very dynamic. You are often stationed at a paramedic station local to where you will be working, and you wait for calls to be dispatched from all medical emergencies that might present to you. I think when you start your shift, the exciting part of being a paramedic is that you never know what your shift is going to be like. You might be having a very busy shift one day and another shift might not be as busy. You might see patients from as young as a neonatal that was just born to as old as someone that is nearing the end of their life. You will see people from all walks of life, from all socioeconomic statuses, from different geographical locations. And I think that day-to-day balance of not knowing what's coming through the door and what the next call might be provides an exciting aspect of what it is like to be a paramedic. Work schedules for paramedics vary, but typically across British Columbia is shift-based. So you will either have night, afternoon, or evening shifts, typically ranging from 8 to 12 hours depending on where you're located. But the important thing to know that is you'll be working shifts that will be rotating from day to night shifts. Sometimes that might be challenging, but at the same time, that provides a unique aspect of seeing all things in your career where another career might not offer a regular 9 to 5 office job. salary range for a paramedic can vary across the province depending on where you work and your level of training. A primary care paramedic can expect to make anywhere from $60,000 to $80,000 as a starting salary within the province, again, depending on where you work. To become a licensed paramedic in British Columbia, you need a certification and licensure with the Emergency Assistance Licensing Board of BC, or EMLA BC. To be able to achieve licensing, you have to have a certificate as either an emergency medical responder or in most circumstances and most commonly a PCP, which stands for the Primary Care Paramedic Program. As a paramedic in BC, you're licensed by the Emergency Assistance Licensing Board of British Columbia. You have endorsements on your license to practice additional feature sets and skill sets such as placing IVs and endorsements such as those. In addition to that, you have to keep your license up and pass your licensing boards to ensure that there is no restrictions on your practice. The difference between an EMR and a PCP is quite broad. An EMR is an entry-level paramedic program that allows you to work in remote places and have the basic skill sets as a very advanced first responder. A primary care paramedic works as a licensed paramedic in BC in all locations in the province without restriction. In addition to that, you are trained in all aspects of primary care paramedic delivery, from first response to cardiac arrest to stroke care to trauma care, and you have that basic knowledge set and skill set to be able to provide the patient the care they need from arrival to dispatch to all the way to you bringing them to the hospital if necessary. The Sprott Paramedical Care Program provides a longitudinal and entry-level from start to finish course that provides you the opportunity to become a paramedic and licensed paramedic through the EMA Licensing Board of BC. What that means is that you are trained from day one all the way to day 100 to be able to demand and respond to all medical situations that could be possible as a paramedic. In addition to that, the Sprott Paramedical Program has a very unique curriculum structure that allows you to see course material over and over again through a circular learning model. What that means is that when you're introduced to topics earlier on, it is not completely forgotten about. You'll be reintroduced to that topic later on as a circular learning model. In addition to that, you have longitudinal simulation as well as preceptorship programs that are unique to the paramedical program that Sprott College offers. To enter the PCP program, the Sprott College program is actually quite unique in its way, as it's a direct entry program. Although most programs across the province will require an EMR, the paramedical program for Sprott does not require an EMR, and is a direct entry program that requires a high school diploma, a basic language certification in English, as well as a medical from your physician as well. The paramedic program at Sprott is very unique in the province. I think having a longitudinal program that trains you to be a competent and having a program that allows you to be a competent paramedic at the end of your training program is very unique. It is a longer program for a reason, to ensure that you are ready to respond to the medical emergencies that you will face out in the real world as a paramedic. And I think that uniqueness of the program to be able to provide a longitudinal, from start to finish, an enhanced skill set to be able to respond to those emergencies is what sets the Sprott program apart from the rest. Practicums and preceptorships will be delivered across the province, as we have multiple agreements and partnerships with various healthcare authorities as well as BC EHS. It's important for paramedics to have their preceptorship and training programs in all distributed parts in the Lower Mainland and other parts of the province if the opportunity arises, as it exposes you to the real life career of what a paramedic should be able to see and expect in their real world career. In the practicum program with Sprott College, you'll be partnered with a licensed paramedic and have real-world, hands-on, outside of the classroom training, which is vital for you to become a successful paramedic. That means you work alongside paramedics in an ambulance, see real patients, and provide hands-on care under the supervision of your paramedic to enhance your skill sets and also to retain and continue your knowledge base and lay the solid foundation that's required for you to become a successful paramedic. Following your successful completion of the Primary Care Paramedic program, you have multiple opportunities to extend and continue your training and other opportunities in the paramedicine world. One of which is the Advanced Care Paramedic program, or the ACP, that allows you to provide advanced care and skill sets as a paramedic. In addition to that, there are also the Critical Care Paramedic programs that are available, as well as infant transport programs that allow you to provide care to infant and pediatric patients as an enhanced skill set. I think the opportunities and the doors that are opened after completing your Primary Care Paramedic program is exciting, and there's a lot of opportunities awaiting your entrance following your PCP program, if you so desire.
Sprott College since 1903.